Check it out, motivators. Look at this 1, 2, 3, A and P. This is your lower extremity. There's your foot down inferiorly. There's your pelvis, tailbone, pelvic bones. Check it out from the lateral view. Pretty neat. The action at the knee. Look at all the structures there. The blue is the front side of the knee. That's the quadricep. You're doing a leg extension, that's what's happening. Those muscles are activating. So we've got 3 muscles on the front of the thigh. The quadriceps, we've got 4 parts of it. We've got a vastus medialis. We've got a vastus lateralis. And we've got a rectus femoris. And then deep within there, there's a rectus intermedius. Or vastus intermedius, I'm sorry. There's a cool muscle called your sartorius. So we go around posteriorly. Oh, by the way, there's your kneecap or your patella. All right. And then that structure right there is your patellar tendon. We turn around laterally and check it out. Squeeze, ease. So you've got an antagonistic muscle groups that are working here. When you curl your leg or flex it, the hamstrings light up. And when you extend your knee, as in doing leg extensions or hamstring curls, you see that it's a little seesaw action there. All right. Just look at the hamstrings. This is very common. People injure their hamstrings, right? We always have football players and soccer players out with hamstrings. So strains, sprains. So we've got 3 hamstring muscles, and they all attach to this bone right here called the ischial tuberosity. You're sitting on that right now because you're fucking lazy and you like to sit around. But if you were to get out there, do some stair climbing, get out there on a beautiful fall day, pre-Thanksgiving, you work these hamstring muscles there. So we've got 3 muscles, or 4 actually. We've got the biceps femoris that attaches out laterally, and then we've got the semimembranosus and the semitendinosus in there. Why they call this one the semitendinosus? Because it's got this crazy tendon, right? And then there's some inner thigh muscles that are also featured called the gracilis. So check out all that's at work here. Color-codedness, very interesting, very educative. Now, there should be as close to a 1-to-1 ratio as possible between the front of the thigh, or the quad, in blue, and the back of the thigh, hamstring. But a lot of times the quad is dominant. We use it a lot, but we're always sitting on the hamstring, so I think we're just turning it off. The pressure that is applied and also the lack of flexibility and lack of comparative use leaves you at risk for injury, strains, sprains, postural imbalances, etc. So you gotta take care of your hamstrings and your quads. Pretty neat.